Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week of April 22nd, 2021. This week, I'm going to pose and answer three questions. That is, how is the pandemic progressing globally in the U.S. and in our region? Second, a question that's come up quite a bit is, how can you help a family member or friend decide to get vaccinated? And then I'll do the update on the herd immunity thermometer that I introduced last week. So how's the pandemic progressing globally in the U.S. and in our region? Unfortunately, globally, we've now passed 3 million known deaths and a 2.9% increase in the last week. This is quite worrisome because, as you will recall, we have not been at 3% since early March. So whether the number's coming back up or not is hard to say, but for the second week in a row, we've had a 3% growth, or 2.9% growth. That's 85,000 deaths last week alone around the world. That's 8 deaths every minute. So the story that's going around that this pandemic is winding itself down simply isn't supported by global data. And this is especially obvious if you look at the number of daily deaths. So this goes back to March when the number of deaths spiked up, fairly even through the summer. Then we had this huge spike in late winter time, and then it came down, but it's now consistently going back up. And if you look at how this compares, you can see that the number of daily deaths we're seeing worldwide is at the highest point, except for late December, early January. So really quite concerning. And again, what's interesting and different from what we've been seeing before, if you look at these are the 9 countries with the most reported cases, and you can see the United States has come down but seems to have leveled off. France has come down but leveling off. To some extent, Italy seems to be leveling off. Spain does. Russia is leveling off but hasn't come down. The only country that seems to be coming down close to zero is the United Kingdom. On the other hand, you've got countries like India where the number of deaths is skyrocketing, Brazil where it's come up, and Turkey where it's coming up as well. So again, it's a pattern to evolving differently in different places, but really discouraging that it's not coming down closer to zero in many of the countries that are most affected. If you look at number of deaths per million, the U.S. is now in 10th place with 1,754 deaths. And that's 1 death for every 570 people in our country. This is still a serious pandemic. In terms of the growth of total deaths in the U.S., we're getting close to 600,000 deaths. The Spanish flu in 1918, 1919 had about 670,000 deaths in the U.S. So we're getting disturbingly close to that. About slightly less than 1% increase week to week, which is actually good. Again, for the second week in a row, we're at 0.9%, the lowest number we've seen since we've been paying attention to this. But even with that, 6,000 deaths last week, that's over 1 death every 2 minutes. And again, as I showed you this pattern before, kind of came up, the number of deaths came up in March and April, fairly even with a little bump in the midsummer, this big spike in the wintertime, and now it just seems to be leveling off, and that's worrisome to me. But again, the good news is it's lower than it has been, but still it's not coming down to zero. If you look at the 9 most impacted states, most of them show this same pattern of coming down and then leveling off. We've really kind of keep an eye on that, because what we want to see is we want to see it coming down, and we certainly don't want to see what we're seeing in Michigan right now, which is a number of daily deaths going up pretty consistently. If you look at where the cases have been in the U.S. in August, September, October, November, December, January, February, March, and April. So again, the disease is everywhere, predominantly in the mid part of the country. In the 5 states in our region, seeing pretty much the same kind of pattern, fairly sizable increase, particularly in the early part of winter, if you will. North Carolina, Kentucky, Tennessee, Virginia, and South Carolina. If you look at the percent week-to-week growth rate, all actually in the 0.5 to 1.5 range. A couple of them higher than the U.S. at 0.9, a couple of them lower. So again, just something to keep our eye on. Make sure these numbers will keep coming down. In terms of the ballot health service area, we were within one death of having 2,000 deaths in our region, and we probably have reached that since this chart was made. 0.4% increase in the past week, which is below the U.S., which is good, but that's still one death a day. But what we've been watching is the hospitalizations. You remember in August and September running about 100 hospitalizations a day. Then it shot up into the 300s, came back down into that 75 to 80 range. But then the last couple of weeks, we've been seeing this creeping back up. Now, maybe it'll come back down, but right now it's at the highest point. I mean, it's higher than it was in August and September. So again, something to keep an eye on. So the pandemic globally is still growing. In the U.S., it seems to be slowing down as it is in our region, but it's not slowing down to the point where we can have some confidence that it's going away. And one of the key things we have to do is get people vaccinated. And so a question that's come in quite a few times is, what can we do to help a family member or friend decide to get vaccinated? Well, the Centers for Disease Control has come out with some recommendations that I think are quite reasonable. It starts by listening to their concerns. Try to hear what people are saying, and then ask open-ended questions. Can you help them understand what they're worried about, where they're getting their information from, what they've done to get answers? Because a lot of times people who are hesitant to get vaccinated are unsure. And if we can help them be more confident, that'll be a good thing. Ask permission to share information, and then give them trusted sources, the CDC, the local health department, maybe even these weekly videos, whatever is helpful to you. And if they have specific questions, please pose them. You can ask me, you can ask your healthcare provider, you can ask the health department. And then help them find their own reason to get vaccinated. Share why you got vaccinated. Discuss common goals of being able to visit safely. Remind folks that vaccinations don't just protect them, they protect other people as well. And then help them make the vaccination happen, right? Make an appointment, offer to go with them, arrange transportation, get connected to resources, etc. So these are good advice. The one thing that doesn't work is this, right? There's no benefit in just arguing with somebody. If somebody is absolutely convinced that COVID isn't serious or the vaccines aren't safe, you probably can't convince them. But for most people, they're really looking for information. And if you can provide it in a calm and systematic way, that can be very helpful. And of course, the goal of getting immunized is to move in the direction of herd immunity if it's possible. Remember last week we introduced it. So in Tennessee right now, 22.5% of people are fully vaccinated and 12% have had natural infection. If you combine these, we would estimate that about a third of Tennesseans, at the low estimate, should now have some level of immunity. If you take in the percent of people that are partially vaccinated, and the fact that there are many more cases than are known, we might be as high as close to 70%. So right now in Tennessee, we can estimate that we're somewhere between 30 and 70%, with herd immunity probably happening somewhere between 75 and 90%. So we're moving in the right direction, but we're not there yet. So the pandemic globally is growing, and the U.S. and our region seems to be slowing down. There are things that we can do to help each other make the decision to get vaccinated, and we'll keep following our herd immunity with the hope that we might get there. We might get people vaccinated before there are enough variants and enough global travel to reintroduce the disease. There's a great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list, or if you're sharing these videos with someone else, please ask them if they'd like to be added. We're happy to add folks. As always, I'd like to thank Melissa White for helping to collate the data and Dara Young for editing, producing, and posting this video. And most importantly, if you have any questions about this video or anything that I've said, or any questions related to COVID, other than questions related to your personal health, because I can't answer those questions, but any other type of question, I'd be happy to answer if I can. Please let me know. I look forward to hearing from you. Until then, be healthy and be well. Thank you.